I'm Dr. Leibovitz, your Central Indiana go-to foot doc, and I'm happy to announce that we now have vascular testing in my office with the smart ABI. Now, testing for ABI is not a new test, but the technology we have is very, very new, and it uses wireless technology that makes it very easy to administer. So what is ABI testing? Well, that's a comparison between blood pressures between your arm and your legs, which can determine blood flow as well as calcification of arteries and give us a good idea how much blood supply is flowing down to your extremities or if there's risks involved. Well, who should be getting ABI testing? Well, according to the ADA, anybody that's over 50 that has a history of diabetes should be tested annually for blood supply. Anybody that has a history of peripheral arterial disease should be tested and monitored to see if there's any changes. A history of coronary artery disease is also important. If you have blockage of vessels in the heart, the chances are really good you have blockage of vessels everywhere else in your body, including your legs. Anybody has a history of lower extremity stents put in should be tested to monitor for changes in blood flow. If you have an open wound, sore, which is an ulcer on your lower extremities, this should be tested to determine if there's enough blood supply to heal. A history of claudication. Now, claudication is cramping or pain that occurs in your legs with walking. It can occur as simply as short as going to the mailbox and back, or it can occur after 20 or 30 minutes. It's relieved with rest, but then returns as soon as activity resumes. If there's a history of cold toes, no hair growth on the toes or foot, and shiny skin, that's a great indication of decreased blood supply. Or anybody using nicotine that's considering an upcoming procedure in their foot or ankle. Nicotine dramatically affects blood supply and reduces it. Or if you have nicotine use and you're using, have any of the symptoms that we just went over, it would be really important to have testing done. So there's two parts of this test. Let's get started. Okay, so the first part of the test is fairly simple. We have a cuff on your left arm and one on each ankle. Cuffs are activated. We start the system. The hard part is just laying back, relaxing, having your arm upward, and no talking. There's more or less a drum hum in the background, which takes about a minute to deflate, inflate, and deflate. So the second part of the test is very similar to the first part. The cuff is placed on the right arm. The ankle cuffs are rotated slightly to monitor the vessel on the inside of your ankle. They're started. The test begins. On this test, though, your feet are going to be rotated to the outside. And again, the same thing. The blood pressure cuff will start. In just a few moments, we'll have a result. So after blood pressures are complete, they'll be run through our software. We'll get a report coming out that will give us your ABI number that tells us the blood flow, but it'll also give us graphs. Will tell us the compression of the vessels to see how much additional risk there are, or possibly if there's a false elevated result. So these will be discussed with you moments after the test. It just takes a few seconds to run. So if you feel you're a candidate for ABI testing, please contact my office. If there's any other information you need about foot and ankle problems, please go to my website at gotofootdoc.com. We have tons of information there for you. So I'm Dr. Leibovitz, your Central Indiana go-to foot doc. Have a great day.